In preparation for assessing my patient, I would first check my patient's assignment on the assignment sheet. I then would lay out my worksheet using patient profile. I then would get a report from my primary nurse, and then I would show my instructor my patient's worksheet and how I laid it out and set up the profile. Hi, my name is Maddie. I'm a student nurse at Lake Superior College. I'm just gonna wash my hands first before I touch you. Could you please state your full name and date of birth?
Riley Fawcett, January 22nd, 1996.
Okay, great. And today I'm going to be performing a head-to-toe assessment, and I'm going to be remaining aseptic technique. This means anything below the waist is considered dirty, so when I'm inspecting your feet, I'm going to wash my hands before I go and inspect anything else above the waist. Are you having any pain today?
Yes.
And where is it located?
It's located in my arm.
And on a scale of 1 to 10, can you rate that for me?
4.
4 out of 10
Mm-hmm.
on your right arm.
My right arm, yep, right here.
Okay. In a normal, healthy adult, their temperature should be in 98.6 Fahrenheit and 37 degrees Celsius. A normal pulse for a healthy adult is 60 to 100 beats per minute. Normal respirations are 12 to 20. Oxygen saturation should be above 93. And blood pressure should be 90 to 120 over 60 to 80. So I'm now going to assess the lungs on my patient. I'm going to make sure that her chest rises and falls symmetrically. And I'm just making sure that her sphenius process is straight. So can you take a deep breath in for me? Okay, and out. And she rises and falls symmetrically. So now I'm going to assess in 6 spots. So when you feel my stethoscope, you're going to take a deep breath in through an open mouth and then out with pursed lips. Between the shoulder blades, not on. And then I'm doing the bases of the lungs. This is underneath the shoulder blades. Okay, and then I'll have you turn around for me. And I'm now going to assess that the chest rises and falls symmetrically from the front. So go ahead and take a deep breath in with an open mouth. Great shape. So now I'm going to assess it in 6 spots here. So when you feel my stethoscope, take a deep breath in with an open mouth. And if I wanted to do 2 more spots, I could have put them right here and on the sides, but that was 6 spots, so that will conclude my lung assessment. Okay, I'm now going to go on to the heart. So I'm going to osculate the aortic, which is in the 2nd intercostal down from the clavicle. This is the aortic in the 2nd intercostal space. And then on the left side in the 2nd intercostal space is the pulmonic. I'm listening there. And then we go down to the 3rd intercostal space. This is Erb's point. We're going down into the 4th intercostal space. This is tricuspid. And underneath the breast, can you pull up your breast for me, please?
Oh.
Yep, and this is the mitral, which is in the 5th intercostal. This is the apex of the heart, and I'm listening for an apical heartbeat. And I would listen here for 1 full minute. Okay, thank you, Riley. So I'm then going to come over and listen and repeat those steps again with the bell of my stethoscope. So again, in the second intercostal, this is the aortic. Listening for the aortic. I then go down to the second intercostal on the left-hand side. This is the pulmonic. In the third intercostal, this is Erb's point. Going down to the fourth intercostal, this is the tricuspid. And then one more time, I'm listening. This is the mitral, apex of the heart. I'm listening for an apical pulse, and I would listen here for 1 minute. Okay, thank you. I should have warned you about that. Okay, so now I'm going to perform an abdominal assessment on Riley, but first, I'm going to ask you a few questions. So how is your appetite?
It's good.
Do you have any troubles getting to the bathroom?
No.
Do you have any problems with urination?
No.
And when was your last bowel movement?
Yesterday.
Okay. So now I'm just going to inspect her abdomen. Again, if this was a real patient, this would be skin to skin. There's no distension. It's not rounded. It's nice and flat. The symmetry is good. So now I am going to osculate in each quadrant, starting in the lower right-hand side. This is the first quadrant. Listening for bowel sounds. And then moving up to the second one, the second quadrant. And the fourth quadrant is the left-hand upper side. And then, well, this is the third. This is the fourth-hand quadrant. The left lower. Okay, great bowel sounds, Riley. Now I am going to palpate lightly. If, according to the abdominal assessment, I would percuss, but for this demonstration, I don't have to. So I'm going to palpate lightly. In the first quadrant, watching my patient's face for any grimacing. Is there any pain here, Riley?
No.
Okay, I'm palpating lightly in each 4 quadrants. No pain.
No.
Okay, now I'm going to palpate more moderately. Watching my patient's face for any grimacing. Any pain here, Riley?
No.
Okay, I don't feel anything inflamed. I then would also chart my patient's I&O, and that concludes my abdominal assessment. I'm now going to do extremities and pulses. I'm going to check her capillary refill in each hand. Okay, I'm then going to check her radial pulses bilaterally. And she has a 2+ pulse bilaterally. I'm then going to check her capillary refills of her toenails bilaterally. Great. And then I'm checking bilaterally the pulse of her feet. And she has a strong pulse. And then to remain aseptic technique, since that was below the waist, I would wash my hands before touching anything else. So I am now just going to assess her skin. There's nice color to it. She's not flushed, she's not pale. Noting her temperature, she is warm, but there's no temp to it. I'm assessing her appearance. She's alert and oriented. Looks cleanly. And then I'm going to palpate her calves and her ankles for edema. Doing that bilaterally. Okay, and then to remain aseptic technique, I would wash my hands first. And when assessing edema, you're going to want to use the edema scale. So 1+ is 2 millimeters, 2+ is 4 millimeters, 3+ is 6 millimeters, and 4+ is 8 millimeters. I then would assess my patient for any NG tubes, chest ports, Foley's, catheters, or any ostomy bags. If my patient did have this, I would chart the character, odor, color, the amount, and the I&O into the patient's chart. So now I'm going to do a neuro check on my patient. So do you know who you are?
Yes, I'm Riley Fawcett.
Okay, and do you know where you are?
I'm at the hospital.
And do you know about what time it is?
It's about 7 o'clock.
And do you know what your purpose is for being here?
A checkup.
A checkup, great. So now I'm just going to assess your eyes. I'm noting the constriction, so with my pen light. Okay, her eyes are not dilated, her pupils aren't dilated. And now I'm just going to assess her strength, so I'll have you squeeze. Good. She's 5+ bilaterally, and that completes my neuro check. To complete my head to toe assessment, I would make sure that my patient is in the low position with the side rails up and the color light in reach, and that would complete my head to toe assessment.